Yes, the allocation of 14.9% of government spending to the health sector in the 2022 budget is very encouraging and represents a positive step, towards the progressive realization of the Abuja target, of allocating at least 15% of the total budget, to health. We welcome, this political will and the commitment towards also achieving universal health coverage. Yes, we know that 15% is not adequate, to deal with the current health challenges in the country. Hence, this will also need to be complemented by the other, innovative, health financing strategies, such as the proposed seed tax and also the health levy from airtime and data bundles. We are aware of the perennial, challenges that have been, bedeviling, our health sector, such as the issue of the human resources for health. Right now, our nurses and doctors are no longer even, bothered to go on strike. They are just resigning, packing their bags, and leaving. Leaving, our health sector, seriously depleted because of the poor, conditions of services. We hope this budget will be able to adequately, address the concerns, of the health workers, so that at least we can, in a way, contain the current brain drain that the country is currently facing. We are also aware of the, dilapidated, equipment, obsolete, machinery in our hospitals and health facilities. And we hope, the budget will also be able, to equip our hospitals with the, at least modern, equipment. We are also equally aware of the challenges of, emergency services, ambulances. Most of our health facilities or districts, have been operating without an ambulance. It is quite sad to see in some or most instances a whole district with a catchment area of about 35 health facilities being served by just, one ambulances. So we hope that the budget would address, these numerous, perennial challenges, including, the shortages of drugs, the stockouts that most of our health, facilities are always, facing. So we hope that this time around the issue of disbursements, timely disbursements of the allocated funds, will also be improved, because sometimes what is allocated is not necessarily what is then disbursed. So we hope there will be an improvement in terms of the, actual disbursements to the health sector. We are still worried that the budget is being, formulated in a period of also hyperinflation. Our inflation was at around 50%, and it's now at about 58%. So the risk of this Zimbabwean dollar budget being eaten away by inflation is really looming. We are also equally worried by the sliding, exchange rate of the official, exchange rate. So all those factors may also reduce, the real value of the budget that has been, allocated, to the health sector. The budget has also been, formulated in the local currency, the Zimbabwean currency, but we are also aware that most of the suppliers for the Ministry of Health are demanding, United States dollars. So all those things may also impact on the, vote that has been allocated to the health sector. But we also want to continue encouraging the Ministry of Health to efficiently use, the resources that have been allocated, to the health sector, and try to plug all the leakages that have been raised, especially by the Auditor Generals, in terms of wastage and so forth. So if we efficiently utilize the budget, it can really make a difference. But obviously, the fundamentals, the economic fundamentals, have to be addressed. The issue of inflation, and also the issue of the exchange rate, so that we then don't lose out on the actual amounts that have been allocated to the health sector. But I think the issue of human resources for health, the conditions of services for the health workers, has to be prioritized in this 2022 budget. Of course, there are also other issues like for the community health workers, health system strengthening. We know the role that is played by, community health workers or village health workers. We also need to make sure that we address their concerns in terms of their allowances, in terms of their tools of the trade. Currently, we have not been, supporting community health workers from our national budget. Either the allowances are paid by the Global Fund or by the Health Development Fund. And I think it's high time now we should harmonize the issue of the, community health workers allowances, so that we can reduce the issue of, disharmony within the community, because we are seeing a situation whereby village health workers, some village health workers that are under, UNICEF or HDF, are getting their allowances on time, getting their, uniforms and bicycles, but there are other counterparts who are paid by the Global Fund, can go for very long periods without receiving, their allowances, and also their tools of the trade. So yeah, at community level, it's also important that we address the concerns of those foot soldiers who make a huge difference, in terms of our preventive, healthcare services.